So Rovalpituzumab, or Rova-T, is a first-in-class, first-in-human antibody-drug conjugate. So it's an antibody linked to a toxin. And what we presented was a final update of the phase 1 study of this drug as a single agent in patients with relapsed small cell lung cancer. And to kind of cut to the chase, what was discovered in this phase 1 trial is giving a dose of this medication IV once every 6 weeks, 2 times, is going to be the recommended schedule of this drug in its phase 2 and phase 3 development from here. What was exciting is that in patients with both sensitive and primary resistant refractory relapse disease, there were high response rates compared with historical controls. So in the overall group, so combining different kinds of patients, heavily pretreated patients, the response rate was just under 20%. So that's exciting in and of itself. But what was most exciting is that if you look at the target of this antibody, which is DLL3, or delta-like protein 3, which is seen in about 90% of small cell lung cancers, if you look at that target at a higher expression level, and in this study that was 50%, the response rate goes up higher. In fact, from about 18% to 38%. And it gets even better if you look at 1 prior therapy or 2 priors. So we have a drug that's really the first of its kind to go after a target in small cell lung cancer. And so the development from here is quite broad. Just quite exciting, especially as we now think about immunotherapeutics showing promise in small cell lung cancer. Just to have another drug showing promise is really an exciting time.